Public health officials in Boston agreed to drop the city's mask mandate. It will happen Saturday for most indoor spaces. Here to answer your questions about that and a lot more, Dr. Elise Worcel, an infectious disease specialist at Tufts Medical Center. Thanks for joining us, Doctor.
Great to see you, Doctor. Thanks for your time. So you have been tracking the city's COVID data very closely. So what does it tell you about the, am I using the right words, the emergency phase of this pandemic? Is the emergency phase of this pandemic over?
I would say, yeah. I mean, I think we're in a really good spot right now. I think the numbers are coming down, and I mean, compared, just thinking about all the other peaks we've gone through and survived, I think we're in a really good spot. I certainly don't think of us in an emergency phase right now.
All right, interesting. Yeah. So Boston's public health commissioner cited a local decline in emergency room visits, hospitalizations, and the ICU beds. All of that is down. So is that what you're seeing? That's what's happening at Tufts?
Yeah, I checked, and I think there are about 6 people in the ICU. And so, thinking back to where we were 2 years ago when we were in the 70s, or even some of the peaks we had more recently with Delta and then Omicron, having 6 people is a sign that we're definitely getting better.
Masks are still required, though, inside hospitals, transportation services, school. I just flew this morning. You have to wear it on a plane. Boston public schools. So what's the point of having different rules for different locations?
I mean, I guess I think each situation in each spot needs to choose for themselves. I mean, in the hospital, there's a higher rate or higher chance you're going to interact with someone who's immunosuppressed and who may be vaccinated but doesn't have a sufficient immune response to COVID and is at risk for severe COVID. So I believe in the people who are running the infection control division of my hospital, and they'll make the right decisions for me, and I'll follow them. They're scouring over the data. And as far as transportation goes, I mean, I ride the commuter rail, and I feel better with a mask on. I am vaccinated. Like I said, I am boosted, but I feel better with a mask on. So I'm happy for those rules.
So, Doctor, businesses can still mandate masks for employees and visitors, even if the city no longer requires it, the city of Boston. So what's your advice as a specialist to managers who have to make that decision? What would you say?
I mean, I believe in the power of democracy, and I would say to the managers to reach out to their employees, potentially in an anonymous way, with a survey or sort of a poll to say, what do you feel? What are your thoughts? Because I think sometimes the loudest voice in the room doesn't necessarily represent everyone's opinions, and especially about this topic, which seems to be incredibly divisive. So I think getting an idea of what everyone feels, potentially anonymously, and if you choose not to require masks for your visitors, or to require rather masks for your visitors, I would suggest having them available, because as we go on with life, we may not be carrying them as much because they're not necessary. And I'd be happy to, if I don't have one and it's part of the rules of your establishment, to put one on. It just makes it easier for me if you have one there for me.
Dr. Worcel, thank you so much for your time.
We appreciate it. Thank you.
Great to see you. Bye-bye.
Great job.